Hey friends, welcome back to Health Made Simple, the place where we take all the confusing medical talk and turn it into something you can actually understand. I'm your host, a nurse, a researcher, and right now a daughter trying to figure out what to do for my mom. And if you caught our last video, you know my mom fell 4 weeks ago. She's 78, full of attitude and stubbornness, and still insists that she can take care of my dad 24 hours a day, though she still has a fracture and she's in a great deal of pain. So her fracture is in her L2 vertebra. We're hoping that rest and pain meds would do the trick, but honestly, she's still in a lot of pain. Maybe worse, and it doesn't help when she's moving around all day getting meals ready for my dad. Yep, my dad is super spoiled, unfortunately. So an update, she's recently had her MRI done and showed that the bone has actually collapsed a little bit more and there's swelling around it. The doctor said it's time to think about doing something more, and given that she's still in pain and the fact that her pain has not really gotten better, so we had 2 consultations. One doctor recommended a procedure called balloon kyphoplasty, but they're booked for a whole month. And another doctor we just saw can take her in 3 days and recommended something called RFTVA, a newer type of procedure, and we'll go over all that. Today I'm going to break it down. What do these procedures mean and what's the difference? Which one should you choose and which one works better? What's the recovery like and what's covered by insurance? Because these procedures are not cheap. So let's keep it simple and start with what is actually broken. So your spine is made up of bones called vertebrae. If one of them gets weak, like from osteoporosis, like my mom, you can take a fall and that can crack or collapse the bone. And that's something called a compression fracture. Now imagine your spine is like a stack of marshmallows. Well, not that squishy, but between the vertebrae are discs that are supple and flexible, which allows you to move your spine around. Now imagine sitting on one. It squishes and there's a minor crack on L2 vertebra. That's what happened to my mom's L2 vertebra. Signs someone has this type of fracture could be sudden back pain that gets worse when standing or walking, and getting shorter because of the compression. So in my mom's case, for about 4 weeks ago, she slipped and fell because she was in a hurry to prepare a meal for my dad. On top of that, she has osteoporosis, making the bones a little bit more porous, so you're more at risk if there was some kind of impact that you may develop a fracture. Now, because she has osteoporosis, her rheumatologist has put her on medication that is supposed to help her not develop a fracture if she falls. But in this case, she did. And when we consulted with the rheumatologist, he suggested we change medications for that because obviously because she has that minor L2 fracture, that medication for osteoporosis for preventing fractures did not work in this case. So there's going to be another video about that specifically, and there are several medications a patient can choose once they develop osteoporosis. But going back to her pain level, it's gotten really worse to where she's taking Norco about 3 times a day. Now, because she's taking an opioid, it does make people very tired and sometimes a little loopy. And I've spent a week now helping my mom taking care of my dad, and she have become a little bit more tired because of the medication. So definitely if you're on these medications like Norco, you don't want to drink or drive. So I'm kind of doing that for her, doing all the errands. Now we did hope that over time that she would eventually get better and her pain would diminish, but that's not the case. And unfortunately, because she's a primary care provider for my dad, but because she's so stubborn, she wants to continue to take care of my dad, we have to find a solution for helping her with this pain level. So because after 4 weeks there was no improvements, doctors will suggest these procedures to actually fill in that fracture. It's as if you were wearing a cast. It creates that structure so that the crack doesn't cause the pain. And that's the theory behind these procedures. And hopefully she will have pain relief. So the two fix-it options that were suggested, we're looking at option 1, which is the balloon kyphoplasty. And this is the classic one you might have heard of. It's also very popular. The doctor puts a small balloon inside the broken bone and it inflates it a tiny bit to make space so they can fill the space with cement to hold it steady. Now think of it like patching a dent in a drywall. Option 2 is called the radiofrequency cement fix. Sounds kind of a sci-fi movie. Well, this is a newer, fancier option. Instead of a balloon, they use a special tool to make a path inside the bone and inject the cement that's heated to the perfect texture using radio waves. It's like using a glue gun with more control. Both are outpatient, which that means going home the same day after the procedure. So what are the cons and what are the pros about this? Well, balloon kyphoplasty, it often restores some loss of the height in the spine, especially if there's a severe compression. And it's really good for fixing posture problems. And pain usually improves within days. The downsides, well, it takes longer to schedule and a tiny chance of where the cement may leak, but that's really rare. But now, unfortunately, the doctor who gave that option can't take her for another month. I can't really imagine my mom having this pain, taking the narco for another 4 weeks. So there's another option. We consulted with another doctor. So the radiofrequency cement, this is the newer, fancier option. Instead of a balloon, they use a special tool to make a path inside the bone and inject the cement that's heated to the perfect texture using radio waves. It's like a glue gun with more control. Both are outpatient. Now, what are the pros and cons? With any procedure, there's always going to be risks. Well, for the balloon kyphoplasty, it often restores some height in the spine, and the pain usually improves fast within days. Downside, well, it takes longer to schedule and a tiny chance of cement leaking. The radiofrequency, super precise in the cement placement, and there's very low risk of that cement leaking, and it's great for fractures that are a bit oddly shaped. But it doesn't really restore height though. But that's okay if the compression isn't severe. So why would you choose one versus the other? And how do doctors decide? Obviously, we were given two options. If the bones collapsed a lot, they lean towards the kyphoplasty, the balloon, to try to lift that compression. So if the bones collapsed a lot, they lean towards kyphoplasty to try to lift it. If the fracture is close to nerves or oddly shaped, the radiofrequency might be safer. And let's be real, sometimes it's about which doctor has an opening first, in our case, right? In our case, the balloon option is 4 weeks out. That's really too long for us. That's a long time when you're in pain every day like my mom. And you might be wondering, what is the recovery time like? Well, you're going to go home the same day. And the pain often gets better in 1 to 3 days or right after the procedure in some cases. And you can walk around almost right away, but there's no heavy lifting for the next 4 to 6 weeks. I'm going to have a hard time to tell my mom not to do that. And she probably won't be listening to me. So let's talk about the money aspect, of course, because even if Medicare covers it, it's kind of good to know what the ballpark cost will be. With balloon kyphoplasty, full hospital billing can range from $10,000 to $16,000. But if you have Medicare, you're usually responsible for 20% or your Part B deductible, depending on your plan. My mom has the original Medicare at this time. The radiofrequency cement fix costs are similar, about $10,000 to $15,000, depending on the provider and equipment. Same deal with Medicare in this case. If it's approved and documented as medically necessary, you're likely responsible for a small portion, a small deductible. One tip is to always ask the provider for a Medicare allowable estimate and make sure they're in network if you're using Medicare Advantage. Good news is that Medicare covers both of these procedures as long as it meets criteria. And that is proof of a fracture. In my mom's case, the MRI shows that. You've tried rest and meds first and it hasn't worked, and you're still in pain after a few weeks. In all those cases, that's my mom. Medicare Advantage might ask for extra paperwork, but it's totally doable. Just call the office ahead of time and make sure they handle the pre-approval. And for us, the logical choice was the radio frequency. It was a tough choice, but we're going with the radio frequency because it's available this week and my mom is in real pain now. She can't afford to wait another month. 4 weeks of pain, I just can't imagine. The doctor we're seeing has done this procedure before and it's covered by her insurance, Medicare, the original. And it could help her feel better within days, I hope. Fingers crossed. And that's a win if that happens. So if you're navigating this with a parent, I really feel you. These decisions aren't just medical, they were emotional. It's hard to watch someone you love suffer while you wait on the red tape. Hopefully this video gave you a more clear picture of what your options are. What's important is that if you are taking care of someone that is your parent, particularly if they have osteoporosis, they will be at risk for fall. And if that happens, you might have a fracture in one of your bones. If the pain doesn't go away with medication, then clearly there needs to be some fix that's permanent so the pain would be reduced. So if this video was informative and it helped, give it a like, subscribe to the channel, and leave a comment please if you've been through this yourself. So we're all learning as we go. Until next time, stay curious, stay strong, and give your back a break. And tell your parents to take a break, in fact.